Hi, I'm Heather Lesch, and I'm here today to talk to you about the Affordable Care Act. Lack of health insurance affects everyone, including you. From emergency room visits to the hospital due to an accident, prescription medication needs, and pediatric care, everyone is affected by the need for medical attention. Access to medical insurance is a huge problem facing families and businesses alike. As discussed in AARP's article, Real Possibilities, 10 items now mandated to be covered by your insurance through the Affordable Care Act. I've listed items here for you that are now part of every health care plan and are required by law. Prior to the institution of this act, there were those who thought that their insurance covered these items, but not always. And with the schools now requiring that kids see an eye doctor prior to beginning school, and many requiring some sort of dental checkup as well, kids are now covered. I can speak about this topic today because as a concerned citizen who has taken responsibility for knowing my family is covered properly, I have conducted much research to become educated on this topic. What is the Affordable Health Care Act? Many know that this by its given name from the public and media, Obamacare. What is the act? Who does it affect? And how do you obtain it? The Affordable Care Act allows everyone in the nation access to health care without the fear of being denied. According to an article in Healthcare Executive released in the July-August issue in 2013, an article titled Access to Affordable Health Care said that in the most recent census, 49 million Americans were without insurance, and the new health care law would mean that approximately 32 million more people would become covered through the new mandate and creation of health care exchanges. Some states, such as Missouri, have refused to adjust their state health care programs to allow those who cannot afford access to their own medical programs. As pointed out in the article Pharmasphere, U.S. Healthcare Policy Update, Impact Analysis of the Affordable Health Care Act to Stakeholders in Professional Services Close Up. Through this reformation, though this reformation was a key part of the program, the U.S. Supreme Court ruled that it was unconstitutional to require that states make changes in their programs to allow those who could not afford insurance to the health care exchanges to get state care. This causes further problems because it does not allow the program to be instituted as it was meant to be. And when I say the program, I mean the Affordable Health Care Act. However, the Health Care Act has removed barriers that were formerly faced by many and makes common care commonplace and mandatory. Children are covered longer. Pre-existing conditions are no longer a tool to keep you from being insured. As discussed in the article, 9 out of 10 healthcare providers say that the Affordable Care Act will be a step forward. Published by the PR Newswire, the Affordable Care Act will help in addressing long-term issues in the United States once it is fully established, and 83% say it is good for Americans. So let's discuss what the Act is, how it works, and how it can be a successful tool for the nation. The Act works by allowing individual families the ability to obtain health insurance. If insurance is not available through an employer, then the insurance can be bought through an exchange. Only persons who have to get their insurance through the exchange can receive what is known as a premium tax credit. These are the tax credits that everybody's talking about. These are families, in essence, who are paying for the entire premium, and the Health Care Act recognizes that not all families can afford this. The premium tax credit is applied to eligible persons when they apply through the health care exchange and qualify for the help. The purpose behind the Health Care Act is to provide those who need immediate access the ability to get it and use the services needed. Those who do not need the immediate service at the time of the inception will at some point need health care. The reason this is aimed to work is because it will cause a balance, meaning that it is there for people when they need it, and that is what insurance is, just in case coverage. Compare this tool to Social Security. If you work to pay into Social Security, when you are of age, Social Security pays you. According to an article in the Tribune Business News, in an article called Dispelling the Myths, Information Meeting Touts Affordable Health Care Act Benefits, James Furta, a healthcare.gov insurance navigator, says this: all we're doing is making it easier and holding the companies to certain standards. What we try to explain is that this sets up essential health benefits, which is essentially a Bill of Rights for the patient. It makes sure that certain standards are met, like no-limit caps and making pre-existing conditions not a factor anymore. It becomes important to know how the Act should work, what can make it not work, how this will affect the public. The Act works by mandating that all persons become insured. This seems extreme to many, and it is one of the most resented aspects of the law. By making the program mandatory, this increases the number of persons who participate in the program. Many will continue not to use the insurance. This will provide insurance companies with the resources necessary to cover treatments. When people refuse to get covered, they make the system harder and set up for failure. This system does rely on the fact that many young will not require the same amount of care as those who are older. It is like Social Security in that matter, as discussed in the article published by the Tribune Business News titled "Officials' Affordable Health Care Act May Be Adopted Like Social Security." The recent problems outlined in Social Security, however, are not the problems of the system, but rather the former government mishandled that money, making the system strained. So let's talk about how this act affects families and individuals, how they benefit, what would happen if we did not have the system in place. Many more families are now able to take care of their basic medical needs for the families. A health disaster is not as devastating as it once was, with the knowledge that a family can only be charged so much for care. Without this reform, medical care was spiraling out of reach for the common person. Many were tied to jobs just to get insurance. In a country that is becoming more reliant to contracted work, it has become harder and harder to obtain insurance for a family that was affordable and obtainable. It cannot lock someone out for having had skin cancer or heart problems. The new Affordable Health Care Act affects us all. Today I discussed how the Act works, who it can affect, and the good it can do for many Americans. Let me tell you about Hunter. Hunter is 9 years old. He is the second born in a set of triplet brothers. While his mother was pregnant, it was believed that Hunter would have severe heart problems. But to the joy of his family, he did not have any issues with his heart when he was born. However, of the 3 boys, it was Hunter who experienced bleeding on the brain at birth, a condition that is common with multiple births. At the time of his birth, his parents were insured by good union insurance, and medical bills were not a huge issue. However, just 2 years old, Hunter's parents lost access to their health insurance, and meeting his medical needs was extremely draining on the family resources. Hunter developed further problems as he grew. He has limited eyesight, and his eyes would move constantly. He developed a problem with seizures and is not mobile in the traditional sense. Through the years, Hunter's father, the only income source for the family, went through a series of company changes. The most recent company where he was employed would not offer insurance to its employees because covering Hunter was a huge burden, over $9,000 a month. Since the inception of the Health Care Act, Hunter has been covered with no issues and no restrictions on his care, and now the family has adequate coverage too. I want to thank you for coming with me today on this journey about the Affordable Health Care Act, and hope that you can make decisions for your family and have comfort and strength that this Health Care Act has been a good institution for the United States of America. Thank you, and have a great day.